So, hi, my name is Daniel, and this is going to be the physical assessment over peripheral vascular systems, an abdominal assessment, and a musculoskeletal assessment. So, starting with the arms, just going to inspect both arms, check for size, look for any edema, and also just note any swelling. Look for the color. Note if there's any redness to it, any bruises. So we're gonna look at the fingers on each hand, look at the fingernails, note if there's any clubbing. Clubbing could be indicative of maybe just like heart disease. Using the dorsal side of the fingers, you're just gonna palpate and feel the hand, the fingers, just up the arm, just noting temperature to make sure that there's not any drastic temperature differences. So you do this for both arms. And then you want to palpate. So I'm going to feel for the radial pulse. Going to feel for an ulnar pulse on the inner side. And then up on the, around in the bend of the arm, I'm going to feel for a brachial pulse. So do this on both arms. And then I'm going to take a finger and just squeeze it for a few seconds. I'm just looking for the capillary refill. Just want to make sure it's less than 3 seconds. When you're looking at the arm, you also want to look and see if there's any, just look at any kind of like venous patterning. And then the last thing you want to do with the arms is known as an Allen test. Oh, and one thing, before you look at the Allen test, so on the inner arm here, between the tricep and biceps, it's the epitrochlear lymph node. You just want to palpate that to feel for that. Sorry, not feel good. Sorry. Okay, but you'd feel for that on both arms. Now you can do the Allen test. So I'm just gonna palpate here, both the ulnar and the radial. So hand's gonna get a little white, a little pale. So then I'm just gonna release. So I release just the radial pulse, the radial side, noted color return. So I would just block them both off again, and then this time I would just release the ulnar side. Your ulnar parts is stronger than your right. Right. So to see the color return. So that was good on both of them. Okay, so moving on to the legs. So you just would inspect both legs, just looking seeing if they're symmetrical. Just look at the size of them, see if there's any swelling in them, any edema. You'd also just look at the hair distribution. Sometimes like hair distribution can be kind of give you an indication of how well their blood flow is. So then you would, again, using the dorsal side of your fingers, you just would palpate and feel for temperature. I'll just do this all the way through. Okay, so and I'm just going to palpate now for any edema. So if there is any edema, you would just give it, like see what level of pitting edema it is between 0 and 4. So in this case, I would say there's no edema. So you also would look at the circumference of the calves. If they're asymmetrical, you would measure each one and just note the size difference. Then you would inspect and palpate the up kind of in the groin up here, the femoral artery, and you could also auscultate and listen for if there's a bruit. And then also up here in the groin is the, you could inspect and palpate for the superficial inguinal lymph node. And then for pulses, I already said the femoral one. Then you would also, down on the back of the knee, you would feel for the popliteal pulse. And then on the forefoot, on the top of it is the dorsalis pedis. And then down at the back is the tibial, or posterior tibial. So you'd also inspect both legs to look and see if there's if they have any varicose veins, any varicosities, and also note if there is any, if they have thrombophlebitis. If there is any varicosities, you can have them do a position change test. This is, position change test is for arterial insufficiency. It's the same kind of sort of Allen test, just seeing how the blood flow in their legs are. If they have varicosities, you can do a manual compression test. You should have one hand be squeezed above the varicosities and the other hand would be a little bit below it, and then you just would release to see the return of blood. And then another test you can also do for if they have varicosities is a Trendelenburg test. Okay, so moving on from peripheral, we're going to do an abdominal assessment. So first thing when you want to do with the abdominal assessment is just inspect the abdomen. You can look at the vascularity of it. Just look at the coloring. See if there's any swelling. You can look to see if there's any masses. You can also palpate for if there are any, when it comes to the abdomen, you always want to do inspection, then you want to auscultate, then palpate. You don't want to palpate or percuss before doing auscultation. So yeah, first you would inspect, just noting any swelling, any vascularity, any color. Then you would inspect the umbilicus, noting the location of it, and then also noting the contour of it. You look at the contour of the abdomen overall, like is it kind of flat, is it round, and then you also would just look at the symmetry, of the abdomen. So after you've done the inspection of it, then you would also inspect it and just to see if you can see any abdominal movements, such as peristaltic waves or aortic pulsations or respiratory movements. So once you've done with the inspection, you then would use your stethoscope and auscultate. You'd auscultate all four quadrants, just listening for bowel sounds. Whenever I do this, I always usually start with the right lower quadrant, and then just go clockwise to just the upper right, upper left, and then lower left quadrants. Just noting bowel sounds. You're mainly looking for the pitch, the intensity, and the frequency of how often they have the bowel sounds. While you're also doing this, auscultating, you also just listen for any vascular sounds or any friction rubs while auscultating the abdomen. So once you're done with that, then we would move on to percussing percussing the abdomen. You gonna be okay if I do it?
Sorry.
All right, sorry. Yeah. So then you would percuss the abdomen. So you percuss all 4 quadrants, just go across the abdomen, listening for tone. You also would be able to determine like if there's potentially any masses. So once you're done palpating for tone, so then you start palpating for different organs. So kind of here in the upper right area, and I'm not going to do it too hard just because I don't want to hurt you, but you would palpate the upper right, you would press and palpate for the liver. Over on the far left, almost kind of on the side, you would palpate for the spleen. Right. Then you would do blunt percussion around the flanks and the back for the kidneys. You would do blunt percussion over the liver, and then you would do in all 4 quadrants. You do light palpation. You do light palpation in all 4 quadrants, just feeling for any tenderness, and also just to see if they guard. Because they guard, that could be like, lower right quadrant guarding could be a sign of possible appendicitis. Once you've done all 4 quadrants of that, then you would do deep palpation in all 4 quadrants to see if there's tenderness for this, and then also to feel for any masses or nodules. So once you're done with all 4 quadrants, then you move on to palpating the rest of the organs. So you would palpate for the aorta. You palpate over the umbilicus, which I will not do that over. I know that's sensitive for a lot of people. You'd palpate around the back for the kidneys. You palpate kind of the lower middle for the bladder, the urinary bladder. And then you would palpate, when you're palpating the liver, you palpate for the, just make sure it's for any tenderness with it and consistency. Also, tenderness for the spleen. So, once you have palpated all the organs, you then move on to, you do what is known as a shifting dullness test, a fluid wave test, and then you would do a ballottement test. And then you also then moving on to the lower right quadrant, you would check for appendicitis. There's six tests you can do for this. So you would see if they have any rebound tenderness, see if they have any referred rebound tenderness. And then you can do it's called a Rovsing signs test, which is where I just would do deep palpation in the lower right quadrant down here. And if they feel pain in the lower right quadrant, that can be indicative of appendicitis. There's also a psoas test, or a psoas sign test, that if I put resistance to their right leg and then ask them to lift it, if they have pain in that lower right quadrant, that can also be a sign of appendicitis. There's also an obturator's sign test that can be indicative of appendicitis, and then also if there's also a hypersensitivity test. And then the last part of abdominal assessment is looking for cholecystitis, and so that's where you just would do deep palpation in the upper right quadrant while they're inhaling. If they suddenly have pain while you're palpating and have just stop breathing, this could be a positive sign for cholecystitis. All right, and then the last part is video is a musculoskeletal assessment. So, so first you would looking at you'd want to assess while they're standing. You'd want to assess their gait. You'd want to see like kind of like their base, their weight bearing stability. You'd want to check their posture, and then like as they're walking, like also kind of see like do they do any kind of an arm swing, and also like note like their feet position, like do their feet, are they like kind of straight, or do they maybe walk a little kind of, just you want to see the positioning of their feet as they walk, see if they have any difficulty walking, like any difficulty bearing weight on one foot or the other. So then you move to the temporomandibular joint. It's kind of right here, like kind of like sort of below and in front of your ears just slightly. So you just would inspect and palpate. Just kind of open your mouth. It's like you can feel like a clicking, and then don't have any pain. You know? All right, and then moving downwards, the sternoclavicular joint. So it's kind of right here where your clavicle and sternum meet. So you just would inspect it, palpate it, look for the color of it at both sides. Note if there's any tenderness or any masses. Feel if there's any swelling in it. Oh, and then, so when I was doing that, the temporomandibular, I forgot to mention, the opening of the mouth and just testing the range of motion, and then you can also kind of like open your mouth and kind of move it a little bit to the side. Okay. So after that, and after the sternoclavicular joint, you just would move on to the spine. So actually, use my setup on the edge here. Use my this setup over here. Or wait, up around this edge here, because I'm gonna need to see your back. Oh. Okay, so I would just inspect and palpate, so thoracic and lumbar. So just starting with the cervical, obviously, and then just kind of moving our way down, just noting for if there's any pain or any tenderness. All right, so, and then I'll just have them do range of motion for cervical, so just kind of do head forward and back. All right, and then kind of side to side, so that's good. So moving down to thoracic and lumbar, so just kind of, you can just bend forward and back, have them see if they can just go kind of side to side, just making sure they have that full range of motion. Mm-hmm. That's okay. And then you also would test the range of motion of their of their legs, and then you just would measure their leg length, but I don't want you to do it. And also just ask them about their back pain. So moving from spine to shoulders, so you would feel the shoulders, inspect them, check for symmetry, if there's any swelling in them, any deformity. And then you just have them also just do range of motion, so just kind of do like a little circle motion, go forward with your shoulders. And then you could also have them do it backwards, but just making sure they have that full range of motion with their shoulders. Right, moving on down to the elbows. So you just inspect the elbows for color, for any redness, any swelling, any deformity. Then you would also have them just do range of motion exercises for elbows, making sure they can move that hinge joint. All right, so then moving down to the wrists. So just inspect the wrists. Just check the symmetry for both wrists, the shape, see if there's any swelling, any redness, if there's any deformity for the wrists, and then have them do full range of motion. Just make sure they can turn that wrist. And then with the wrist, you also want to check for, do a test to see if they have carpal tunnel syndrome. You okay?
Yep.
You sure?
Mm-hmm.
I thought you were following.
Mm-hmm.
And then just moving on to the hand and fingers, just look for swelling, for any deformities with any of the fingers. Look at the shape of all the fingers. We already talked about looking for clubbing in the fingernails. And this, you would check each finger individually just for range of motion.
Spirit finger.
You don't have a double jointed thumb. So after the fingers, you would then just move on down then to the knees. So for the knees, you can turn around over this way. Right, so for knees, you would just look at the color, see if there's any swelling, any redness in the knees. Sorry. Look for any color, any swelling, redness. You want to look for any edema, any like extra fluid. If there's a little bit of fluid in the knee, you would do a bulge test. You just kind of put one hand below, one hand above, and just kind of bring it together. You can kind of see like a little bit of a rippling effect just from that fluid. If there's a lot of fluid, which usually just is enough fluid that you can like see it without having to do any kind of that test, then you would just do a ballottement test. And then the last, I'm just gonna hold the thing down here. And then the last is an ankle exam. So you just would look at the ankles for any swelling. If there's any swelling, any redness, any deformity, any masses. And then just like all the others, you would just then do a range of motion, make sure they can move it. Hear it creak. Oh, one more test I forgot to mention about for the knees. If they have any clicking in their knee when they do it, you can perform a McMurray test, which can be indicative of maybe having something wrong with your meniscus. Alright, so that's the end of this video. Sorry for all the camera angles.